Hello everybody, welcome back to my channel. My name is Pinky. I'm the clinical pharmacist practitioner. So I have made a video on acute sinusitis, and as I have done this video, I was thinking that I should simultaneously also make a video on chronic sinusitis. So what is sinusitis? Let's discuss about that first. Sinusitis is a problem of the sinuses, infection of the sinuses. Now, what is sinuses? Sinuses are they are like hollow spaces in our facial region. And when there is swelling in those region, those are our sinuses, the hollow spaces around this area, around our forehead. So in these areas, when there is some kind of inflammation, then we have sinusitis. So sinusitis is sinusitis, right? So it's inflammation of the sinuses. Now, in acute sinusitis, the symptoms usually resolves within 3 weeks. But in chronic sinusitis, that's not the case. Chronic sinusitis, it's a long-term condition. Now, basically, I'm making this video for one of my friend who is really suffering from sinusitis, and she really needed my advice today. And I thought, why not make a video on sinusitis? So basically, what is it? In sinusitis, what happens? There is a cycle of mucosal inflammation, okay, and which causes swelling. Now, what happens? There are so many mucuses which bungs up around these areas, all right, around these areas, and when this mucuses basically gets around these areas, it causes inflammation and swelling. And when there is this swelling, there is this reduced ventilation, okay? And when there is reduced ventilation of sinuses, what happens? Nothing is moving anywhere, right? There is no flow. It's not moving. There is mucus retention, all right? And when there is mucus retention around these areas, then there is infection. Because of this retention, there is infection, and thus there is further inflammation. There was already inflammation, then there will be further inflammation. Now, in order for an acute sinusitis to be chronic, it has to be it has to persist for at least 12 weeks. And if it is after 28 days or 12 weeks, there is evidence which suggests that if it is more than 12 weeks or 28 days, either of these, then we say, yeah, it is chronic sinusitis. Now, basically, a number of patients who has got chronic sinusitis, they will have some kind of polyps, okay? And these polyps inside the nose, it's like inflammation, all right? It's like a blockage around these nasal passages or somewhere around there, and this needs to be checked by, obviously this needs to be checked by a diagnostic tool, and whether there is any polyps or not. And basically there is ENT surgeons, ear, nose, throat surgeons, who can identify with nasal endoscopy, and sometimes, yeah, it has to be found out without examining inside the nasal passages. Basically, it can't be ruled out whether there is a polyps or not. So for this reason, in primary care, so primary care is where I work, it is the GP surgeries. But in order for a proper examination inside the nasal area, inside the nasal passage, the patient needs to be referred to an ENT surgeon. Now, let's talk about the causes and the diagnosis. Now, For chronic sinusitis, there are multifactorial reasons. There can be a number of reasons. It can be if the patient is allergic to something, if the patient is a smoker, or if the patient is asthmatic. Now, what are the presentation? I have already discussed about the presentation in my acute sinusitis, but I'm going to explain them again. So basically there will be nasal blockage, okay, and there will be constant runny nose. It can be there or it can't be there. There can be facial pain. Will be pain around the facial area, and there will be a pressure as well. And there will be a reduced sense of smell. So another most important in chronic sinusitis is to rule out the red flags. So what are the red flags? If the symptoms are one-sided, not both sides, is a red flag. If the blockage in the nose, it's not going away, nothing is helping, it's a red flag. If there is blood or blood-stained discharge coming out from the nose, it's a red flag. If there is a double vision, it's a red flag. And if there is like protrusion of the eyeball as if the eyeball is popping out, it's a red flag. If there is excess water coming out of the nose, it's a red flag. It's known as epiphora. There can be neurological symptoms as well related to the nerves. If it's related to the nerves, it's a red flag. And there will be, swellings of these areas as well. It's a red flag. Now, for the facial pain is basically, it's not commonly associated with chronic sinusitis. If somebody has got like facial pain in the face, it's not basically associated with chronic sinusitis, particularly in the absence of other nasal symptoms. Now, also remember that dental infections can mimic sinusitis. Now, as a general rule, it's very, very important to check swelling, if the swelling is associated with dental infections or not. It's very important. We often advise our patients that please do seek help from a dentist as well. Just have a clear examination if the sinus problem is not going away. Now, in order to have further investigations in chronic sinusitis, we often need to refer the patients to secondary care, to hospital, because MRI is required sometimes to have a proper scan. It's very, very important as well. So what are the treatment options we have for chronic sinusitis? For chronic sinusitis, there is nasal steroids. The nasal steroids, there is like mometasone, there is fluticasone, there is beclomethasone nasal spray, and it's basically high dose nasal spray, and it is usually for 14 days. And sometimes I often come across patients as well where the ENT surgeons have asked the patients to use it long term. So it depends on the clinician's judgment how long the patient needs to use the steroid nasal spray. Then there can be oral steroids as well. Now, oral steroids can be used for any severe condition, and it does help. 25 to 50 milligram of prednisolone for 2 weeks before moving to any other treatment. It does help. In many patients, it did help. I have seen it. And another thing is about the nasal irrigation. So nasal irrigation, it can be made up. Basically, in order to make nasal irrigation, what you need is 1 tablespoon of salt, half tablespoon of let's do it again. 1 teaspoon of salt, half teaspoon of baking soda, 1 pint cooled boiled water, and a clean container. And you will need a neti nasal irrigation pot, and mix all the ingredients in the clean pot. And a new solution should be freshly made for each use. Now, this nasal irrigation, let me tell something about this nasal irrigation. When I was working in the hospital, there was this consultant who simply used to love the nail med rinse. The nail med rinse, you can buy it over the counter. Nail, N-E-I-L, nail med, M-E-D, med rinse, R-I-N-S-E, nail med rinse. He used to prescribe Nalmedrines like to many of his patients. It's excellent. I have used it by myself, and there are YouTube videos on Nalmedrines as well. It looks yucky, but it's not yucky. It helps a lot. So basically, there is this bottle where containing the solution, and you take it through one nose and you drain it through other, and it's really cleans up whatever is inside, and it's really good one. Now there can be surgical options as well if there is any blockage or anything inside the nose, any polyps. And obviously after there are so many options. Now another thing which I have to keep in mind is when to refer the patient. If the presence of red flags, um, if there is red flags, urgent referral. And if the response is poor, even after 4 weeks, I'll refer the patient to an ENT or specialist. Another thing is about asthma and chronic sinusitis. There is a link between these two. And what happens sometimes, patients who has got like recurrent polyps, okay, and they're very sensitive to aspirin. Sometimes patients with chronic sinusitis, I will tell my patients, like, try to avoid aspirins over the counter. And another thing is, in some of my patients, there is another medication which sometimes helps a lot if the patient is specifically asthmatic. That is leukotriene receptor antagonist. That is Montelukast, 10 milligram for adults once at night. And for children, it's basically the dose varies. So basically in chronic sinusitis, we tend to look at the overall picture. And if there is red flags, obviously we will refer the patient. And if there are no red flags there, we can prescribe some steroids, oral steroids. There can be nasal steroids, and we can also advise the patient about nasal irrigation. And even after all this management, the patient is not responding, we will refer the patient to a specialist. So another thing I will say is, if your symptoms is getting worse rapidly, do seek help. All right, it's very important to seek help immediately. If you really feel well, use your judgment how you are feeling, because chronic sinusitis, even acute sinusitis, it can be sometimes dangerous if it is associated with other kind of infections. And if you're systematically unwell, seek help, please. That's very important. Now, thanks for watching, and if you have any questions, put in the comment section below. And do like, share, and subscribe my channel to motivate me more, and hope to bring more good videos for you guys. Thank you, and do take care of yourself and stay safe. Bye for now.